Hi, my name's Matthew. I'm a spinal physiotherapist from myPhysioSA, and I work up in Mount Barker and also in Wakefield Street at the International Spine Centre. I'm here today to talk to you about what physio can actually do to help solve your back pain and get you back to the things that you really want to get back to. The myPhysioSA team are experts at managing low back pain, and our goal is to work with you as the patient to come up with the best plan to try and help you achieve your goals. In order to do that, we usually will conduct an assessment to give us the information that's going to help us to work out what that treatment plan is going to be. So when you come into the clinic, we usually sit down and have a bit of a chat, and that really involves us listening to you to try and understand exactly why your low back pain is impacting on your life. And what it also helps us to do is to work out whether or not this pain is something we can help you with, because we know that in about 2% of cases, low back pain is an indicator of something more serious, and in that case we'd refer you on to a doctor or a specialist. But otherwise, we know that the other 98% can be helped really well with physiotherapy. So when you first have that initial consultation, we will ask you lots of questions like how you first got your back pain, whether it came on quickly or slowly. We ask questions about what makes the pain worse or what makes the pain better. So they could be things like whether you like to walk or to stand, or whether you like to sit. We also talk about whether you have pain at night or whether there's a pattern of the pain during the day. And all of this information will then help us to work out what's the best treatment plan for you, and it will also help to direct where we go with our physical assessment. Okay, so now I'm going to go through a typical assessment that I would go through with someone with low back pain. And the idea of this assessment is to give me a few ideas about how best to try and set up a treatment plan that's going to help achieve the goals of function and of also trying to reduce pain. So the first thing I'd always look at is how somebody is moving. So that happens from the moment we actually meet the person in the waiting room and we bring them through into the consult room. But to starters, I could have a look at just how someone is actually sitting in terms of posture. So we just have a look and see what the posture's like. We could get someone to stand up. Okay, and we're watching the whole time as to how somebody is moving. Next, we could get somebody to just have a look at how they're moving. And look, in this case, we do like to try and, where possible, have a look at the back itself. But we can still do this without you having to take all your clothes off. So in this case, I'll just get Stephen to try and bend forward just as far as you can, as far as you feel comfortable, and back up again. And we're just watching and seeing how you're moving. And then we could go backwards. Okay, and back to the middle. And then we can go, and there are other movements we can go and look at as well, side to side. Have a seat. Okay, next there are a whole lot of special tests we can go through, and these help us to try and work out how best to manage somebody. So for example, we could try a little slump test, which is slumping down. Yep. Okay, and straightening one leg out in front and back down again. Okay, and then the other leg and down again. Okay, and sitting up nice and tall. And we're going to monitor how people are moving, but also what their symptoms are like and what their pain levels are like when they're moving. Okay, so once someone's on their tummy, it's a really good spot for us to have a feel of the tissues of the back and of the spine itself. So we can get in here and we can have a feel of through the tissues. Okay, and we can work out whether there's any particular areas that are tight or stiff. We can come in and we can have a feel through the spine itself, and just to get a bit of an idea. In this position as well, we can then have a feel through the glute muscles. Yeah, just to give us an idea about what's happening in those tissues. So once we've completed our assessment, we then will sit down with the patient and have a chat about our findings, and most importantly, come up with a treatment plan that's going to be specific to that patient in achieving their goals, which is both functional and also trying to reduce their pain. So when we think about treatment, we've got lots of options. So we have manual therapies, we have exercise, and movement retraining, and depending on the assessment will depend on how we utilise those most effectively. So one of the key treatment techniques that we have from a hands-on point of view is we can get in and we can just do some really gentle tissue release, and the idea is to really try and relax those muscles through the back. We can also work further up the back as well if there's tight areas there. We can then go through and do some mobilisations through the joints in the back, and once again they're designed to try and loosen up those soft tissues. But I think more importantly, the hands-on stuff are a really good technique to try and help facilitate movement, because once we've actually got the patient moving better, the next step is to set you up with some exercises that you can take home and do at home to then further improve your pain and your function. So thanks for watching this video. I hope it will help you to decide whether or not physiotherapy can help with your back pain in the future. And we're always here if you've got any questions.